Ray Hanley is the CEO of the Arkansas Foundation for Medical Care. He and I caught up for a conversation about the governor ending the pandemic emergency. Let's begin with the governor's announcement on Thursday that he is ending the pandemic emergency that the state's been in for roughly 14 months now. Is Arkansas ready to have this pandemic emergency ended?
I think it was time and pretty inevitable. I think people have COVID fatigue. Nobody wants to wear a mask again. We've got about half the eligible population vaccinated or close to it, and are all working hard on that. And I think emergency or not, we still got to push really hard on the vaccination front, and AFMC's out there putting some pop-up clinics up and trying to do our part, and we're going to try to do a school project over in East Arkansas here shortly, now that the 12 and up is eligible.
I have got my teen daughter got her vaccine, so she was excited to be able to get into that latest bracket that opened up. Where are you seeing the biggest deficiency right now in terms of COVID-19 vaccinations? What particular groups or areas?
It's still rural areas. It's still a population that is consuming too much misinformation on the vaccine, and I think there's some lulled in complacency here, that we're sort of on the bubble. If you look at the numbers last week, and with the variants out there looming, we have got to push really, really hard to get more people vaccinated, or we're some risk of sliding back.
Right. All right. Coming out of a legislative session that was overshadowed by, I would say, COVID-19 and culture wars, how did the pandemic impact the legislation from your perspective?
I think it probably took away some attention from things that they might have focused otherwise on. I think there was, the conflict with the governor over his emergency powers, when I think he acted reasonably and appropriately, probably took away a little much time that I would like to see devoted to some other things. But, all in all, I think they ended on a good note as far as healthcare goes, with the refunding the Medicaid expansion, rebranding it ARHome. I think from our interest in the healthcare front, I think that was huge. And
let's talk a little bit about ARHome there. What do you think is the strength of this new program, and did it have some deficiencies, some things that you think it might not be addressing as well as it could?
Well, just to start with, we have re-upped for, I think, about the 8th year now in a row, the Medicaid expansion. And when you look around the South at all the states that have still refused to expand Medicaid, like Mississippi and Alabama, Georgia, Florida, Texas, I think we can be proud of Arkansas on that front. We've got Missouri, where the voters said expanded and the legislature said we're not going to do it. So I think Arkansas can feel good about that. I think some of the things in the ARHome legislation have a lot of potential, particularly with rural hospitals, trying to get them involved. The work requirement obviously has been set aside as a mandate. Courts are not going to let us do that. I think the carrot approach that is there is pretty clever. If you'll participate in the work, education, community engagement, it's voluntary, but if you'll do it, you get to stay in a private plan. If you choose not to participate when you're otherwise eligible, then you revert to Medicaid fee-for-service, which makes it a little harder to get an appointment and see some specialists because the fees are about 40% less. But again, participation is voluntary. And then they chose to address some really key issues. And, this is a lesson in it's not enough to give people coverage, just to give people an insurance card, particularly in a state as unhealthy as ours. And the lower income people, there's a correlation obviously with poverty, have more challenges in accessing the healthcare system. And I think they've tried to address some of that. And part of it comes from leadership from people like Missy Irwin and Michelle Gray that have a background in healthcare that helped draft some of this, working with DHS and the governor's office. I think the effort to reduce infant mortality is there. That's one of the targets. And Medicaid pays for about 65 to 70% of the births in this state. So we have a huge financial interest in trying to improve outcomes, because we rank very poorly in maternal outcomes. Yeah. And a bad birth, if the child ends up in, say, the neonatal nursery, it's not only very expensive, several $1,000s a day, but it sets them up for a lifetime of issues.
Yeah, I think a big challenge will be education about some of the new elements of this ARHome going forward. Last question for you. Did anything not get done in this session from a healthcare perspective that you feel was kind of a critical need?
I can't think of anything now that they could have addressed and didn't. Setting aside some of the social issues that you've still got the state employees insurance to deal with, which is cost overrun, and they've got a study in place and a consultant to work on that. But the proof in this whole thing, the ARHome thing, is going to be how it's implemented, particularly the role that's carved out for these rural hospitals, the critical access hospitals. I think the infrastructure was passed. The challenge is going to be in implementing it and the oversight that goes with that.
Yeah. All right. He is Ray Hanley. He's the CEO of the Arkansas Foundation for Medical Care. Always great to get his take. Ray, thank you for your time.
Thank you, Roby.